Welcome back to the doctor's desk. Today, we'll be discussing a very important topic, dengue fever. With increasing cases worldwide, it's essential to understand what dengue is, its symptoms, how it's diagnosed, treated, and most importantly, how to prevent it. So, let's get started. What is dengue fever? Dengue fever is a viral infection transmitted by mosquitoes, especially the Aedes aegypti mosquito. These mosquitoes bite mostly during the day, especially early morning or late afternoon. Dengue is caused by 4 different strains of the dengue virus. Getting infected by one strain gives you lifetime immunity against that particular strain but doesn't protect you from the other 3. This means you can get dengue up to 4 times in your lifetime. Prevalence of dengue. Dengue is common in tropical and subtropical regions, including Asia, Africa, and Latin America. Every year, around 400 million people get infected globally, and millions require hospital care. The spread of dengue typically increases during the rainy season, when mosquitoes breed in stagnant water. Symptoms of dengue. The symptoms of dengue usually appear 4 to 10 days after being bitten by an infected mosquito. The key symptoms include high fever up to 104 degrees Fahrenheit or 40 degrees Celsius, severe headache, often with pain behind the eyes, joint and muscle pain sometimes referred to as breakbone fever, rash that appears 2 to 5 days after the fever starts, nausea and vomiting. In some cases, mild bleeding, like nosebleeds, or gum bleeding. Severe cases can develop into dengue hemorrhagic fever (DHF) or dengue shock syndrome (DSS), both of which can be life-threatening if not treated promptly. Diagnostic points and lab tests. Diagnosing dengue can be done clinically by recognizing the symptoms, especially in someone who has recently traveled to or lives in a dengue endemic area. Lab tests help confirm the diagnosis. The NS1 antigen test detects dengue early in the infection. Dengue IgM and IgG antibody tests check for recent or past infections. A complete blood count (CBC) often shows low platelet levels, thrombocytopenia, and reduced white blood cells (leukopenia). In some cases, liver function tests may be elevated. Treatment of dengue. Unfortunately, there is no specific antiviral treatment for dengue. The management of dengue is mostly supportive care, which includes rest and drinking plenty of fluids to prevent dehydration. Acetaminophen paracetamol is recommended for fever and pain relief. Avoid aspirin and NSAIDs like ibuprofen, as they can increase the risk of bleeding. In severe cases, patients may need hospitalization for fluids, platelet transfusions, or even intensive care for complications like DSS or DHF. Prevention of dengue. The best way to prevent dengue is to avoid mosquito bites. Here are some practical tips. Use insect repellent on exposed skin. Wear long-sleeved clothing and pants to reduce skin exposure. Mosquito nets are useful, especially for children and in areas where dengue is common. Eliminate standing water around your home where mosquitoes breed, such as in flower pots, water containers, and open drains. Denguevaxia, a vaccine for dengue, is available but is only recommended for those who have had dengue before. To summarize, dengue fever is a viral infection spread by mosquitoes. It causes symptoms like fever, headache, and severe body pain. Diagnosis is confirmed through lab tests, and treatment involves supportive care. Most importantly, we must focus on preventing mosquito bites and controlling their breeding areas to avoid the spread of dengue. That's all for today's video on dengue fever. If you found this video helpful, don't forget to like, share, and subscribe to the Doctor's Desk for more health-related content. Stay safe and take care.